Coming up on Mental Health Matters with Marty, what do the medical experts have to say about staying safe in COVID? Stay tuned. What's up, everybody? What's up? What's up? Hey, welcome to the Mental Health Matters with Marty show. And again, my name is Martina Sellers, and I am your mental health hygienist. And we are coming to you live in the state of California, where the sun always is shining. Listen, we had a beautiful day out here. We're kind of having some hot weather. It almost feels like summer. But let us know you are live. We got a great show for you today. And as always, this show is meant strictly as an educational tool. We are not a substitute for any medical, psychiatric. We don't replace the CDC or anything like that. We give you our best suggestion and advice on how to stay healthy in the midst of this COVID. But again, if you're experiencing any type of medical or psychiatric emergency, dial 911 or go to your nearest urgent care ASAP. So with that being said, what's going on, everybody? Listen, like and share. Let people know we are out there. Come on, let us know you're out there. What's going on? Carlos, what's happening? Annette, what's going on? My girl, what's happening, y'all? Let us know you're out there and where you're listening from. We are so excited. Listen, I got some good folk on here today. But before we even bring on our guests, can we bring on our resident person himself, our resident household therapist, school expert, all that above, all the way from the DMV. We won't hold it against him. You know, he still don't realize that the West Coast is the best coast. But other than that, let's bring on Thomas. What's up?
Happy Tuesday, Marty. What's up, my brother?
What's going on? Wait a minute, you're not even wearing none of your A5 paraphernalia today?
Dude,
what's up with that?
I am coming as Thomas tonight.
You're coming as Thomas tonight. We ain't even got none of your frat brothers on here tonight either.
Just me. Just me. Look, what you see is what you get tonight.
Yes.
What's up, Miss Elwood? Charlotte's in the house.
All right, Charlotte. What's going on out there, Thomas? What's happening in the DMV?
It's cold right now. Actually, the temperature is dropping. They said that we're going to get in the low 30s on this evening. We've had wind gusts up to 25 miles per hour. So things are blowing around and moving and shaking, just like what's going on in the world. So we just adjusted to the shaking of the wind, you know?
Well, listen, we had some 80-degree weather out here, so I don't know, my brother. I can't take that, you know. Hey, I told you West Coast is the best, but you're going to stay out there in the DMV. Go ahead and stay out there.
Hold on. You know I was trying to get out there, but, you know, there is no travel ban right now, so I can't come. So
listen, y'all keep your COVID selves where you're at and stay home and shelter. No, yes. You know we got nothing but love for you.
I am not going to endorse that. Dude.
Listen, when you're safe, come on out.
You know what? Don't make me go get my mask and put it on.
Come on out when you're safe. This is my self-care.
Where's your speak up, speak out, and live mask?
I had to order some more. Hey, we passing them out.
Yes. Right. He got some jokes tonight, but it's all good though. I got it.
Yeah, Thomas, you know, with everything that's going on, how are things with school and everything? Because, you know, it's a lot. We're still in the midst of this pandemic that was supposed to be stay home for 2 weeks. And we are rolling we're close to a year of stay in shelter.
As of March 15th, 2021.
Yeah, and we're getting close to a year. And people I always say this, we are in COVID fatigue.
Right.
You know, we're in COVID trauma right now.
Right. I would just say that overall, the District of Columbia Public School Systems decided that they're going to press pause on how we reintegrate back into school. So we're still doing the remote learning piece, virtual learning, asynchronous learning. The main concern is just making sure that we are safe for us as staff, for us as students, for us as families, for us as adults overall, with many things that's been going on in our nation's capital. We have had a lot of visitors in and out.
Right.
So the cases in the district are actually going up as well.
And everywhere now.
Right. And in Maryland, we are at a 7% positivity rate. And even in VA, so we're just on lockdown in a sense, not locked down, but we are just staying in the house, just trying to just stay safe, bro.
Well, we want to encourage all that. Yes, Janice, how are you? Well,
Hey,
Thomas,
Janice.
I'm excited about our guest tonight.
Me too.
With that, they're both my sisters. One's just a sister from another mister, but that's all right. And I'm so excited to bring them on. So without any further ado, listen, we can talk all night, but I want the expert to come on and share with us. First, I'm excited. First time on the show. She is my old college roommate. And what I loved about her, we both started at UC Berkeley, and I met her, and it stood out. And I share this story quite a bit whenever I talk about Dr. Allen. We had to introduce ourselves in the Summer Bridge program, and she stood up and says, "I'm Gwen Allen, and I'm going to be a doctor," and sat down.
All right. That's how you do it.
That's how you do it, and what I love, she has a passion for our community. She's been in her own private practice for 20 years. And when it wasn't even popular, she took a risk on herself. And not only is she the best roommate I ever had in my life. We were roommates for 4 years. She's not just a sister to me, but she gives me opportunities. I have another office out of her office. She says, "Listen, I need you. I'm putting an office in my new office, and when you finally make some money, we'll talk about you paying me." But you need people like that.
You do.
You need people like that.
You do.
And everything. But she's doing the thing. A part of the Gardena Women's Center in Gardena, California. None other than Dr. Gwen Allen.
Hey, hello, Dr. Allen.
What's doing?
Dr. Allen, what's happening?
What's going?
We're doing all right. How are you?
I'm okay. I'm excited about coming on, telling about some good things that we can do to stay healthy in a time of COVID.
Yeah.
Especially for our people, just to make sure that we understand that this is a real thing.
It is.
People are not taking it serious, and we need to take this virus seriously.
So real quick, and I'm going to bring on Dr. Ghiloni next, but how are the what you're seeing, some of the misnomers that we are seeing, especially like in LA? You're in LA County. You know, you deal with a strong population that you are specific towards African American women and Hispanic women. When I say she got hablas español all throughout her office, and she, Dr. Allen is now, I'm not going to say how old we are. We are still looking.
We're young.
There you go.
Reverse birthdays. That's right. But what would you say with your clients and your patients that you are seeing, some of the misnomers that we still carry about COVID?
Right. I think in our community, what we're still seeing is people are just saying it doesn't exist.
Right.
We are not privileged to see that all the sick people, since you don't have a sick person in your household, you're starting to believe like this does not exist. This does not happen to me. Right. But it does happen to you. We walk around and all these people are COVID positive, but asymptomatic. And that's the myth that people don't know. So you're going to sit and hang out with all your friends and you're going to pass the virus to everybody.
Right.
We're testing people, and especially Black men, wear your mask. It's okay. You can be cool with it. I'm okay with being cool with it. But we have to get into our community to say, it's okay. Wear your mask. So don't spread the disease around to everybody. Oh, I don't have it. If you don't have it, at least put a mask on your face so you won't get it. And that's the problem. Or they say, oh, well, I want to go out and hang out with my friends. But everybody has to protect. You can go out and hang out. Wear a mask, people. That's all I'm saying. Because what's starting to affect, we're seeing it now in our pregnant mothers. We're seeing it now in the babies that are being born. All those things that happened in February is coming out now. This is a real disease. And I hate the fact in our community that we're dismissing it, that we're just covering our nose when we're going into the store. Oh, we're going to be okay.
Right.
That is not going to help us at all. So you must wear a mask.
Dr. Allen, I never thought about it now. You're really right. We're now starting to see those pregnancies now 9 months, 10 months out, we're now starting to see, you just blew my mind right there, because now we're seeing what's happening. And you say pregnant women who may have it, and now the babies as a result of that.
Right. And it's really a sad case, because now we're limited to people that come and see. So now you're a mother delivering a child by yourself.
Yeah.
The fathers can't come in because we don't want him to infect everybody else, because we can't test the father. We're only going to test the mother. Then we have to make sure the baby is protected for at least that 2 to 3 days that we have it. But still, when that baby comes home, wear the mask, limit the people. Everybody wants to see it. Everybody wants to have a gender reveal. Everybody wants to see what's happening. Skype, Facebook is doing great. So continue to do that. Put your baby on that page. Skype everybody. This is my newborn. Hey, you know, but
you ain't got to physically touch the baby. Just look.
Exactly. Here, see, hey, it's healthy, because if not, you know, Uncle Pookie and Johnny come in and spread the virus, and the little baby gets sick, and which it picks up. We don't see it until later on.
Right.
To protect the families.
Right. Wow. Marty, there was a comment that popped up on my other page from Justin Leach. He says that it's almost becoming the new norm. Right. And so I just had a question for you, as you are dealing with new parents and just women. So hold on. Shout out, guests. We got women in the house tonight.
Yeah,
women are running the show tonight. The ladies are running it tonight. So my question is, when the females are coming into your agency and building, are they overwhelmed? Are they nervous because of COVID?
Right. They're actually overwhelmed because of the fact that they don't know what's going to happen to their child.
Right.
We have no research data to say how this baby will present.
Right.
We don't know if the fever is a normal newborn teething, newborn process of colic or anything. So anytime there is a fever, we say rule out COVID first. And that presents a lot of anxiety.
Right.
You went to the hospital now as a pregnant mother. You spike a normal fever where we may have thought you had a UTI or something like that. Urinary tract infection. You automatically get isolated and whisked off to another room.
Right.
Because we got to make sure that you're not COVID. So that brings a lot of anxiety.
Right.
That brings a lot of stress.
Right.
And then you go home into that partner or to that household where people are not believing.
Right.
And so that woman is kind of left alone and needing some type of mental health services, because someone to need to talk to them and say, this is okay for you to have some type of anxiety, because you have to protect you and your child. And then sometimes you have to go against the norm to do so, meaning you can't come over and visit me. You may have to stay at home for a little while. You traveled outside of California or you went somewhere. Stay away from me and my child, my unborn child, for 14 days. So those are kind of stress in things that women are dealing with right now. That's very stressful to even tell your loved one, maybe even your partner, stay away from me for 14 days. So I know that you're not bringing something home to me.
Yeah.
That's good. Thank you for sharing that.
And what I love about Dr. Allen, Thomas, she's very unique because she believes in the relationship of mental health services and, physiological and doctor services and physicians as well. And how it's so important to bring those on together and how we meld those together. Because now what we've been able to do when it went out of her office, we can do a warm handoff. So she now says, hey, I have a therapist already working with me. And
that's
so
awesome.
She'll invite me into the exam room with her and says, hey, it's okay. Now the patient trusts Dr. Allen. Now Dr. Allen has recommended her mental health therapist, and then now it cuts back on the relationship, the rapport that you have to build.
Right. I love that. That's a dynamic duo.
It is. And if more of us would do that, what a better outcomes we would have.
Agreed. Also, I just love the fact that you said, Dr. Allen, some anxiety is good anxiety.
Correct.
Because you got to make sure that you are protecting yourself and protecting those that are around you. So to our viewing audience, a little bit of anxiety is okay. A little bit.
Right.
Not a whole lot, but just a little bit.
So with that being said, I want to bring on my other sister who's on here, and she is now doing as a psychiatric nurse practitioner. And I love that because we know that there is a deficit of good psychiatrists out there.
Yes.
2, we know there's a deficit of psychiatrists of color, Black folk, Hispanic folk, all of that with that. So I'm so excited to know my biological sister, none other than Dr. Lisa Ghiloni.
Hey, Dr. Lisa.
Hi, Lisa.
How are ya?
What's going on, sis?
Doing well.
Okay. Don't you love all the truth and new discoveries that Dr. Allen has been sharing with us and how it affects us with that as well?
Yes.
Mm-hmm. Yeah. So again, Dr. Ghiloni, introduce yourself again and what you are doing and what you're seeing, some trends that you're seeing in the psychiatric realm of COVID and how it's affecting us.
Absolutely. So it's funny because now I'm seeing parents. They would bring their kids in, but now I'm seeing parents because now they're trying to deal with their kids at home.
Mm-hmm.
And not only the mothers, but the fathers,
right?
Which is a little different. But I'll tell you, we first talk about non-pharmacological interventions before we go right to medication. But that's where they're headed. They want something to help them, manage their kids during the day. But that's what I'm seeing. The other thing I just wanted to mention is, I'm a little frustrated and I get it, that we're letting our guard down when the numbers are higher than ever.
Yes.
And I am even seeing or have talked to some colleagues that are going back to work. And I'm like, now?
Right.
They're not essential workers. They can do it from home. So and also, does the employer have enough support, not just COVID support, but also, but mental health support for those who need it coming back to work? So those are the areas that I'm seeing.
Yeah, you're absolutely right. We have let our guards down, and Dr. Allen is saying that too, that we're letting our guards down, and we have to be vigilant, because even when she was getting on pre-show, she had her mask up. I was like, Dr. Allen, you ain't gonna wear your mask, maybe.
Model the behavior.
This is my new attire. This
love
goes
it.
with the makeup.
Love it. Love it.
But it's becoming a part of our daily routine. And I actually, I'm having some new, so what I'm doing, Thomas, I'm letting y'all know I'm having new masks made, and I'm putting on the front of it, self-care.
That's good.
Yeah, because we have to learn how to take it seriously.
Yes.
My mask is self-care. I'm taking care of myself first so that I don't spread it, but also so I don't also receive it, because I love myself enough to put on a mask.
Hello. And I have one as well that says, talk it out. We're going to talk out of our mask. We're going to keep our mask on. We ain't going to spit on no one. We ain't going to have bad breath on nobody. We're going to talk through the mask. So I love that. I love it.
The one thing that I really like about this COVID is this distant thing.
Yes. Yes.
Right. But with that, so Dr. Allen, I know we were talking about, we as a community still don't believe that this is affecting us. What is your advice that you give to us, especially is how can we stay healthy during the holiday? Is there any, can we take a vitamin regimen? Are there some other things that we need to be more aware of that will help fight this and even our exposure to this COVID?
What we're looking at now is just your regular multivitamins, your vitamin D, your vitamin C. If you take your regular multivitamin, you should be okay. The goal is to stay and continue to be healthy all throughout the time. Your leafy green vegetable, things like that. I know we like Thanksgiving. We want to stay, eat the greens and all those things, but you got to add some green vegetables into that, and some string beans and things of that nature. So we have to tailor our diets a little bit more to add in leafy greens, and just to stay healthy. If you get a cold, make sure you douse yourself with the vitamin C, things of that nature, your echinacea. Stay healthy, stay on top of it. That little sniffle in this day and age can turn into something else. I do advise, like we talked about, this is my personal opinion, because what I see now, we're having a rise in flu. So if you want your flu shot, you need to get your flu shot. You need to stay healthy. The new COVID vaccine is coming out. Again, my recommendation, first round, I'm not quite good on first rounds of anything. Second and third round, yeah, I'll be in line for that. So in order for me not to catch COVID right now, because I'm one of the first frontline healthcare providers, we stay on vitamin D, we stay on vitamin C, we wear our mask 24/7. Like I said before, if I was talking to you, actually I wear a mask in the room, Marty, I tell you, by myself.
Yes.
Because that just has become a part of life for me. And that should be everyone's part of life. And don't take it lightly. And be healthy. Stay away from these fast food restaurants. We got an opportunity now to stay at home and cook and do these things. Like learn new recipes, learn recipes that can keep us healthy. And that's what we should focus on at this point.
Eat healthy. I love that.
Yeah, because I know, Thomas, you be out there trying to get your jog on and everything.
Jog with a mask.
I do.
Now I got the one with the vents for that one.
I have that one on. Yep. There we go.
And then they told you, Thomas, when you're jogging, right? It doesn't matter if someone is across the street. It's that person that's in front of you that's all the saliva coming behind you. So even if you jog, that's why we say jog with the mask, because that person is, even though they're 6 feet, that sweat, that wind, those germs are coming right behind you. So be careful with that.
Yes, ma'am. Thank you for that. So to all of my people that are working out, wear a mask.
That's right.
Wear a mask.
That's right.
Veronica's on there. Sleep is important too. Hey, Veronica, did you see her, Marty?
I didn't see her yet. Okay, Miss Veronica, what's happening? Yes, that's our other sister.
Okay,
from another mister.
You know what? So I was watching on the news this morning, and there was a segment that was speaking about anxiety around when you catch COVID. And they were saying that there has been an uptick in individuals who have tested positive for COVID, that their emotional state is at a high because they are nervous when someone is coughing around them. They just feel like that, whoa, I need to move, so I don't want to catch COVID again. So can we just talk about how do we deal with anxieties for those who have tested positive before?
That's good. Dr. Ghiloni, can you text us? We're talking about anxiety and everything.
Yeah, and not only anxiety with the COVID, but now we have the time change and we have drop in temperature, especially in the northern states. And so we have a lot of people who have, on top of the COVID anxiety, the seasonal affective disorder. That anxiety that comes on. And I know I'm one of those that when it comes to fall, I just, and winter. So, there's things we can do like light therapy, which actually works wonders. And that's a non-pharmacological thing you can do. Get your light lamp, and you can get it for less than $50 on Amazon. You put it on around 8 o'clock every morning, and for about a week, the research is stating that doing the PHQ-9 scores are much improved just from that light therapy. So
can you explain to those who don't know what the PHQ-9 is, what score that is, and what it measures? I know what it is because I use it, but most won't.
PHQ score is something that I do for all of my patients that come in. Initially and routinely. It stands for Patient Health Questionnaire, and it's a self-administered tool that we use. We don't use it for diagnosis completely, but it gives us a good understanding of where you're at. And, questions.
Love that.
Yeah. Dr. Allen, what do you say with those who are dealing with anxiety? And I love, Lisa, that you're talking about definitely the natural ways, because too often I think we've missed out and think that all psychiatrists or all doctors are trying to put us on some sort of pharmacology, but that's not necessarily the case, because I know, Dr. Allen, you're always talking about what are some natural ways that we can heal ourselves in that. And Dr. Ghiloni, you've been talking about the same ways, but what are some natural things that we can do when we find ourselves maybe even isolated in a hospital room or at home because we are sick, to keep our depression and anxiety at bay?
I think in all cases, when you're in that self-isolation, you always have this self-reflection. So I think one of the things first is educate yourself about the disease process in itself. Once we know that your 14 days isolation, we don't know as medical professions, again, if you're going to get it again, if you get it again, how severe it will be. So I think if you kind to what's the word I'm looking for? Learn about the disease. Know that once I get COVID, I'm COVID positive. That doesn't necessarily mean that I will get the far extreme of the disease. Just like every process that you can get a cold. Someone may have a simple cold, and somebody may transfer that all over to the flu. So there's different processes. So you got to understand that. So when you sit in that room and say, I got COVID, so the next thing you should do is say, what did I do to get it? Did I expose myself? How can I do things a little bit differently? May I wear my mask all the time? Talk to my friends about protecting themselves. Then therefore you make it an educational experience for everybody around you. You don't use this experience as a curse. Basically, and sit there and say, you know what? I'm gonna make this experience as a way of getting better. So therefore, your mind, you will grasp your concept around that. I don't necessarily need the medicine. The biggest problem that we have is that once someone hears that I got COVID, they think they're going to that far extreme. I'm gonna be on a ventilator and I'm gonna die. That does not necessarily always happen. We're in the hospital 24/7. So yes, when COVID first hit, I'm not gonna lie to you guys. I was standing at the door going, I took that Hippocratic oath, but do I really want to go through that door and know that there's a possibility that I might die? So doctors too had anxiety. Pretty much anxiety, knowing that I can possibly go home and die. I can take this to my family. I can do that. So after we learned the disease process, we came along with protecting ourselves, knowing that you take off that clothes, the things that you had. Was on for 24/7. Leave them at the door, put them in a plastic bag, and put them away. But at the same time, just making sure your mind is right and wrapped around it to make sure that you can get through this. This is not, a death sentence.
It's a mindset. We have some people out here that are COVID. I call it COVID schizoid, because we are so scared that we're going to catch COVID, but we don't think about it when we go to the grocery store. We don't think about it when we're pumping that gas, when you're walking into this store and you pulling over that door. We're not thinking about that as we're pushing the carts. But the moment someone calls, oh my God, you got no. And I just think that the social media and the news have positioned us to think wrong. And I'm just so glad that you ladies are just making it plain and just wear a mask, wash your hands, stay 6 feet apart. You can still have a life during the pandemic. Just be smart about it. And you ladies are making it so simple and so plain and giving us factual information. So to all of our COVID schizoid people, relax.
Quit calling our listeners schizophrenic and schizoaffective.
You know what? Let me go back and talk about Thomas. When this thing first came out, I didn't even want to walk out and check my mailbox. I didn't want to do anything. I'm like, oh my God, I'm gonna catch COVID. No, we have to stop saying what we're going to do and get, because they say if you think it in your mind, it's going to eventually happen. So we have to walk that path and do what these ladies are saying. Wear a mask, put on gloves. It is the flu season. Go get a flu shot. For those who are in flu shots, for those who aren't, take natural herbs. But we got to be smart about it. But let's just not overthink this thing. That's all I'm saying.
No, totally
so I was calling myself a COVID schizoid.
I hear you. And as a COVID survivor, as I got it in July, and that thing wiped me out. I'm not gonna lie, and I hear you. And thank you, Dr. Allen, for sharing that. Even as in the profession, yes, you do take the Hippocratic oath and with that, but you're still going, I don't know if I want to deal with them or not. Right. And I'm not gonna lie, I did have a moment even in COVID. Now I knew it was not unto death. However, you still have those moments where, oh my God, is this symptom getting worse? Oh my God, is my chest? Because I couldn't sleep and breathing. It was difficult for me to even climb my stairs or walk around the block, and I was winded. I'm like, this is the end. This can't be the end. And so I had to, what I call, me, my phrase, Thomas, I had to stop the stinking thinking of that and say, no, I'm going to get better. What do I have to do? This too shall pass. With that, taking my vitamins. I was taking zinc, vitamin C, vitamin D, echinacea, black seed oil, turmeric, you name it.
Right.
I think I was getting OD.
And you should still be taking it right now.
And I still am, because you know what it did? It made me vigilant about my health. And I feel much better post-COVID than I did pre-COVID, because I'm now making sure that I'm on this healthy regimen.
Right.
And that's what, imagine if now we all were vigilant about our health. And it's sad that for some of us, it took us getting COVID to get more serious about eating right, exercising, making sure we're taking all the vitamins and minerals that we're supposed to on a regular basis in order to remain healthy.
I like that, Marty. That's good.
Yeah.
That's good.
With that, so Dr. Ghiloni, now let's go back to this whole thing with mental health, and especially over the holidays. What are some coping mechanisms and coping things that you could recommend for those who may not be able to? Because Thanksgiving, especially for Black folk, you know, we gonna do the hog mog and the greens, and we're gonna do
the chitterlings.
No, I can't do chitterlings. I'm sorry. Oh, okay. But what are some things that families could do now that we can't necessarily get together, but still hold because I hate the term social distancing. I like physical distancing, because social distancing implies something psychological. Physical distancing, I can make and handle that term better than social distancing, because we think we're now social isolation. I'm not telling you to be socially isolated. I'm saying we might call for some physical isolation, but never social. What are some things families could do to help lower their anxiety about not being together over the holidays?
Well, first of all, COVID is not the gift we want to give at the holidays. So.
That's good. Right.
And in reality is, unless everybody is going to do the same safe behaviors, there's no guarantee that if you have a gathering of any type, even, you know, if it's one person, that everyone's going to be safe. But I do want to say this. I think we have to be realistic, although, you know, we are medical professionals. We are going to caution that we don't do these gatherings. We don't do the Black Friday shopping, but rather do the Cyber Monday shopping online. But I guess that there's going to be some instances where people are going to get together. So I think you've got to also look at, how can I decrease my risk? You're not going to totally decrease it unless you both, you know, everybody isolates for 14 days and get tested before you go. What's the least intrusive, you know, type of or less risk you can go into? Because I do think it's kind of it's just not realistic for everyone not to get some people to gather during this time. And then you have mentally ill, disabled, intellectual, that they have to go, you know, somewhere. So, and I'm just going to say, slow down and breathe. Take time for yourself. I'm now a big proponent of aromatherapy, and I see you have your candle there, Marty.
Yes.
I'm using candles everywhere in the house.
Totally.
But go for a nice walk or hike, you know, during that time off. Doing daily devotions, and just be proactive, just like you were saying, taking vitamins and things like that, and getting your immune system up and being proactive. Same thing with your mental health.
I love that. I was actually with her in a session earlier, and this family was just so overwhelmed about what am I going to do this year for Thanksgiving? And I said the same exact thing. If you know that people want to be around you, and you know that they've been out doing certain things, then step number one that I always say is, don't put yourself, the word is you first, right? Y-O-U, self. Don't place yourself in a position to where you can become, at risk. I mean, it just bothers me how sometimes we are so consumed with what we used to do, but we are hard to adjust to change.
Yeah.
And for me, I love my family. I love being around everybody. I am a people's person. However, I'm smart about some decisions and choices that I have to make.
Right.
I told my mom just the other day, I am going to go see her for Thanksgiving, but don't be offended when I walk in your home with the mask on. Why is that? Because I live in Maryland. I'm traveling from Maryland, going through DC, going to Virginia to get to North Carolina. I'm going to stop for gas. I'm going to do all those things. So I don't want to put myself or you at risk. And so I do agree with you. Let's just stop the action. Let's breathe and let's make this thing happen. It's not the end of the world. So thank you so much for sharing that. We just got to learn how to just be thankful for the small things.
Yeah. Yeah. So, Dr. Allen, what other advice would you want to tell us as especially people of color as it pertains to this COVID? I mean, I hate to be like a broken record, but my thing is we're going to shout it from the rooftops till we get it and understand it. Example, for some of the pre-existing conditions that do affect us as a people that may not, because aren't the latest surveys talking about that it affects us 2.5 times more likely than our counterparts. Thank you.
And that is absolutely true. And that's a combination of a lot of things. I won't generalize and say that Black people have more hypertension, diabetes, obesity is one.
Right.
But the problem is that it's not the fact that it's COVID. It's the fact that we didn't take care. I won't say we again. That's overgeneralizing.
I hear you.
We have a tendency not to follow through with our medications and doing the proper thing ahead of time. So when something on top of our comorbidities hit, it wipes us out much quicker and faster. And we're the least likely to go to the hospital. Some people run to us with a sniffle. You will have to, a Black woman has to be on her knees, crawling on the floor before she opens that door to go to the doctor. So sometimes when we get there, it's a little bit too late. So my recommendations, again, will be start with yourself first. Again, healthy dieting, healthy eating, taking your medication.
Yes.
If you have high blood pressure, garlic is not going to cure it, people. I'm sorry.
I hear you.
Take your medications, do what you need to do. The diabetes, your insulin, eat right, exercise. Let's do all of that first, in addition to your medication. So let's stay healthy. Then once you get the diagnosis of COVID, again, it's not a death sentence.
Right.
Start first of taking care of your comorbidities.
Yes.
Take your medications.
Yes.
Make sure you're following up with the doctor. If they say lower your salt intake, don't go to Miss Dash and say, oh yeah, I just took a little bit of salt there. It's okay. No, you have to make sure you follow your diet. Over the holidays, if you're diabetic, yes, that piece of chocolate cake will kill you. Stay away from it. Just let's learn some discipline in this area.
Yes.
Again, the previous president had access to care. He got COVID. He had an anesthesiologist behind him. He had a pulmonologist. He had everybody on his team. We don't have that same access to care, and that's what we need to say. So our mortality rate goes up because of the simple fact that we do not have the same access. We do not have that same care. Right now, the hospitals, we're starting to be overwhelmed again.
Yes.
So your little sniffle is going to be pushed off to the side for someone who needs that bed.
Yes.
So take care of yourself first at home. If you need to call your doctor now and get your meds ahead of time so you won't have to go out, they also deliver your meds to you.
Yes, they do.
So let's start taking care of us again, like you said, Marty, self-help. Our health is important. In order for us to stay healthy, we need to take some initiative first. We cannot expect the government or somebody else to take care of our health problems. We have to do it.
It starts with you first.
Yes. Right. Yeah. And I love that, because we have to stop blaming other people for things that we can control. Even with anxiety, I tell people that part of the anxiety is we worry about too many things that we cannot control. So one of the first things we have to do is take responsibility for the things you can control. What can we control? Baby, we can control what we intake in food.
Right.
We can control.
Push that plate back.
Push it back. Get you a little saucer. Eat smaller portions. You ain't got to eat the whole cake.
A little bit of it.
I know that pound cake, and that's right. That sweet potato pie is good, but you just need a sliver.
Right.
I want to touch on something that you said about anxiety in the Black community.
Yes.
I think it's important for us to understand that it's okay to have some anxiety, mental illness, and you can talk to a therapist. Talking to a therapist does not deem you crazy. Talking to a therapist is somebody who has you dedicate your life, or you can, like a life coach, put you on that road.
Yes.
So
Dr. Allen, can you say that again, please? Talking to a therapist means what? Does not mean
make you crazy.
Thank
It's
you.
not crazy, but so many in our community, we all know that.
Right.
That, oh my God, you see a therapist, you see a psychologist, oh, you must be crazy. No, I need help with dealing with some things. You just need to process the thought. And that's the first step that we need to take to understand that you need to talk to somebody first. We want to carry, especially Black women, we want to carry the world on our shoulders. People already call us angry Black women. So what we need to do is learn to talk to somebody and vent and understand that it is okay. It is okay for you to talk to Marty, to talk to anybody, because that's the way that you're going to get over.
Right.
And then within this crisis that we're having now, we're not asking you to put the burdens on your shoulder and take care of everybody.
Right.
We're saying that let's talk about these things. Let's see how financially it's taxing you, emotionally it's taxing you, and physically. This whole COVID thing is taxing us across the board, and we need help.
Right.
And we have to start with our mental capacity.
That's good. That is good. Marty, can we just shout out our women tonight, our ladies? You guys are giving us a different side tonight, and we love it.
They are.
We love it.
And I love it because we have this now, these medical experts,
right,
who are advocates of mental health and an integrative approach to our overall health and wellness together. Because let's be honest, most of us, and I love this partnership that Dr. Allen and I even have, because I will see the client 2 or 3 times within that month, where she might see them once a quarter. So now I can say, hey, here's the progress that we're making with, of course, permission. You have to have informed consent with that. But now she can do a better job of diagnosing on the medical side. Because now I'm sharing on the mental health side, and we can put a treatment plan together that's more effective for the overall patient. So now we take patient care to its highest level.
And you know what it's called? Teaming and making sure that everybody knows what everyone is doing. That is the effective way.
Yep. Go ahead, Dr. Ghiloni.
No, I was just saying, it's a collaborative effort. It's care. But, even if you don't have a lot of anxiety or depression, there's nothing wrong with being a counselor, a therapist. We go and get oil changes every so many miles prevent. It's preventive care. So being a therapist, sometimes, you have, stress coming down, maybe kids going off to college, wedding coming up, and there's going to be some stressors. There's nothing wrong with checking in every once in a while just to make sure you're mentally healthy for what's coming ahead.
I love that. You just gave us men that go out here and get our oil changes. We need to put that in our head. We're going to go get our oil change, guys. We're going to go talk to somebody. Thank you so much, sweetheart. I love that. Thank you.
But it's putting it in the proper analogies.
Right.
I know in the past 4 months, and Thomas, you can probably attest to this as well. Over the past 4 months, I've had more Black men seeking therapy than I have in the past 4 years.
Yep.
And we're open up. Now my approach is a little bit different with Black men than I do with my other patients, because now I say, a lot of times I used to say, hey, what I'm seeing is you're going to need about 40% me being a therapist to you, but the other 60%, I need to be a life coach to you.
Exactly.
So I'm glad even Dr. Allen and Dr. Ghiloni, you guys talked about life coaches, and that is okay. Because as a coach, from a male perspective, I can cuss you out, I can tell you off, because a coach wants what's best for me. A therapist wants to tell me what to do. I'm not here to tell you what to do.
Exactly.
It's your choice.
Right.
I'm just here to help coach you along the way and everything. Lisa, what are some of the stigmas that you see with mental health, and especially you're talking about now delivering maybe some prescribing some psychotropic meds that we may not quite understand in that, we're talking about Wellbutrin, my favorite. Give them the Wellbutrin.
Wellbutrin's good. It's activating. It keeps you going.
Yes.
If someone is, feeling low and no energy, Wellbutrin's great. Yeah.
But what are you seeing as some of the common misnomers, or even why we are hesitant to see a psychiatrist? Because I might be crazy. You're not crazy. We just need to balance some things out. But what do you see?
Yeah, we need to normalize this.
Yeah.
Yes.
I think NAMI has a lot of great things out there now, articles, and I try to post those as much as possible because really we all have mental health issues at some point in our life. Everybody's had more anxiety than we should probably. Felt down. There's many times in my life that I felt really, really down. So we have to normalize it. But and I think we're gaining some leeway on that. I think the biggest stigma that I see right now is when we have very severe mental health cases like bipolar or schizoaffective or schizophrenia, things like that. This is more common than we think it is.
Yes.
The psychosis that we see, even with street drugs, can actually just, we know that it's late. I don't know what to say on here, but
I see you dancing around that, trying to be polite about it.
But she did it good. She did it good.
But even with that, that's a whole nother, and I'll have you guys back on that show. I think we need to talk about some of this, as marijuana is legalized in California, and what do we view on that with some of the mental health and some of that. Some of them are like, yeah, you need to go get you some gummies, help you calm your butt down. I'm sorry, that's a whole nother show.
I know. Let me just say this though. When you legalize it, you know that if your patients are going from heroin and now they're on cannabis, that's a big improvement.
It is.
But I would like them to go to a dispensary versus the street because I don't know what's in that cannabis. And I have a friend who's a provider, a physician in Philadelphia, and he has a methadone clinic. I'm getting off. Sorry. But anyway,
you're all right.
We actually test the marijuana in there, the street marijuana, and there are things laced in there. So,
but that is true.
Get off topic.
But that has been our pharmaceutical place, the street pharmacology with it, and we know those. And Dr. Allen, you've probably seen those where they've been laced with other things, and you're like, baby, you got some bad weed. Let's just be real. Stay off the street weed. Go down the street and get it the right way. With that. But listen, this has been phenomenal, guys, and I appreciate you, Dr. Allen, Dr. Ghiloni.
Yes.
Parting words, what would you like to tell our audience, Dr. Allen, about even during this holiday that you want to remind them of how to stay safe during this COVID time?
What I want to do is demonstrate this.
Good.
I want you guys to wear it properly, right? This is not wearing a mask, right? So this is not going to get you walking into the store. Okay,
right?
You're not protecting anybody. You're not protecting yourself.
Right.
You put it above our nose. You got to also make sure that your chin is actually covered here. What we normally do in the healthcare profession, you see, I press right here. Therefore, even if you wear glasses, which I don't have them, when you breathe or talk, you don't get air that comes up to fog up your glasses, right? Times where people do that. So we want you to make sure you wear these properly. Also, there was a myth on the internet saying that if you turn it backwards, there was some blue in the white side that you can stop it from transmitting the virus. No, the white side of the mask always goes in.
That's good.
So you do not flip that mask out. It's only meant for one side uses. So don't get caught up into that. I know it's going to hurt your ears and doing things like that, but always up over your nose, pinch it, make sure it's over, well fitting. So even if you get cloth masks, it is still appropriate for you to always wear it above your nose, pinch it, and you will stop the transmission of the virus. And I think that's the most important thing. Wear your mask. It becomes a part of your life. This is your attire. When you look for, combing your hair, putting on your tie, things like that, this is now your new, like you said, the new norm. This is your attire everywhere you go. Like someone said earlier, when you go to Thanksgiving dinner this time, regardless if it's your grandmother, if it's your mom, if it's anybody, you wear that mask. Even if you're the only time this mask should come off at Thanksgiving is when you are eating. And you should also have 6 feet of distance between you across the table. And then after you finish, if you want to talk again, you put that mask right back on, and you can have your family gathering, but you're well protected, washing your hands, sanitizing, and moving on. I think we can still have a healthy Thanksgiving, but if we will keep our masks on and keep protected.
Love it.
Dr. Allen, can you answer that question as well? Do you also need a mask if you are wearing a face shield?
That is correct. If you are wearing a mask, you do. We wear if you wear eyeglasses, you don't need a face shield. So basically that comes from the concept that the virus is transmitted through the air, can get into your eyeballs through the mucous membranes. So if you have glasses, you don't need a face shield. But if you don't wear glasses, sometimes we wear a mask and a face shield depending on the environment. I only wear my face shield when I know 100% sure that there's somebody, like there's an infected COVID patient, I'm guard from head to toe. Because I don't know, this will not only protect me, it doesn't protect my eyes. So at that time period, I will have my goggles on and things of that nature.
Okay.
So if you wear glasses, you don't necessarily need a face shield. But if you don't have glasses on, yes, I would recommend that you wear a face shield and a mask.
Oh wow, that's good to know. I need to get my shield out.
You got some good. You got your contacts now. See, at this.
No, I had LASIK.
Oh, you got. Oh, wow, you got LASIK. You can see now. I'm sorry, Marty. I'm joking.
Now who got jokes? I told you, Dr. Allen been knowing me. She's been knowing all the blind side of me.
How many do I see? I'm joking, Marty. You have to make sure that you do have your eyes protected. Your eyes have to be protected, especially in environments like you're funny, Marty. Your household, the people who you've been with for the last month or 6 months, that is your own bubble. The problem is bringing people into your bubble. So be careful over the holidays. Those individuals that you bring in to your bubble, they have to wear their masks all the time. Have some, they don't have to wear the complete face shield, but as long as they have on glasses, we should be good. So protect your bubble. That was my advice to you guys. My parting words, Mark.
Love it. And then I'm typing in here for Daryl to put up there. How can people, because we already had a question, people want to know how can they stay in contact with you, Dr. Allen, Dr. Ghiloni? How can they get a hold of you? What you said through me. I put up, and Daryl's making a banner for you for the Gardena Women's Center. There we go. Women's Center. That's your practice.
That is correct.
Yes.
And they can send us an email at Gardena Women's Center, sbc.global.net. I'll send that to you. I think it's on the card. Yeah.
Okay. So Gardena Women's Center at sbcglobal.net.
That is correct.
Okay. And right before I get to you, Dr. Ghiloni, Dr. Allen, can you, I never did get to share, so you can tell our listeners your specialty, both practice-wise and all the other amazing other subdivisions that you do as well.
No, I was about to say something smart. I forgot. I'm a board certified obstetrician and gynecologist. So I deliver babies in 4 hospitals here in Southern California. I've been practicing OBGYN since 1998. So I'm only 21 years old. But also, the reason why I know about a lot of other things, I do bioidentical hormones as well. So we have a practice that specializes in hormone replacement therapy for men and women, along with vitamin replacement therapies.
Oh, nice.
We also own another portion of our group called GWC Aesthetic and Lasers. So we're one of the only, I won't say only, one of the few Black-owned and operated laser hair removal, tattoo removal, skin tightening facility here in Southern California.
Right. So we can go get all this taken care of. I need to get all this taken care of under here.
Yeah, I can take
Allen.
the hair bumps off the men and the ones in the back and underneath that. So we could talk about that.
Right. Well, tread softly, Thomas. Tread softly. Dr. Ghiloni, parting words, and how can we get a hold of you?
All right. Parting words is do one thing to enhance your mental health.
Love it.
Whether that's just reaching out to someone you haven't talked to a long time and saying, hey, I was just thinking about you. And just one thing to enhance your mental health. And you can get a hold of me through rosepsychiatricservices.com.
Rose, R-O-S-E.
R-O-W.
Rose psychiatricservices.com.
Yes.
Got you. And then Daryl, I know you're up here making banners, so I don't want to touch it. But Cynthia Davis put in here that she would love to know more of what Dr. Allen does. There we go. Can you touch?
I would love to know about bioidentical hormones. Do we have time for that?
She's asking. We always got time when our listeners want something. Okay. Go ahead and talk to us about it.
So bioidentical hormones, because what happens is that for so long we have been replacing hormones with, when women come to us with high flashes, night sweats, and things of that nature, foggy brain, we'll basically put you on a medication, Prempro, or anything of that nature, and say, take this, and we hope you get better. What we found out, if we draw your blood, and that each woman is different, so therefore we'll say she may need estrogen, she may need testosterone, or she may need something else. So we basically replace your hormones with hormones that are specific to you. They're soy-based. It's called pelleting. So we pellet you, we give you a little small bit of, like say you may need 10 milligrams of estrogen to make your mental clarity, as opposed to someone who may need 30 or 100. You may have a decrease in libido, and then therefore we draw your panel, we find out that you may need testosterone, and we will give those hormones back to you. But they're plant-based. They're not synthetic-based hormones that are manufactured in a pharmaceutical lab.
Awesome.
And so we found that there's a lot. It's a difference, and that has a lot to go with too. We do a full assessment to figure out what you're missing, and we're trying to balance your hormones that way.
Awesome. Cynthia Davis, thank you for sharing that, because she's put in there also, Dr. Allen. She says, nothing has worked for me. So she said,
go to our website, take a look at it, and we can help her out with that. And she can go to our website, we can email her back and tell her what hormones we can have her doctor to draw, and then we can tell her what she can supplement it with.
Awesome. See, listen, y'all just got a free session up in here, free consultation and everything. So yes, Dr. Ghiloni, thank you so much. Listen, we cannot thank our guests tonight enough. Dr. Allen, Dr. Ghiloni, y'all have gotten some amazing medical and psychiatric advice tonight. Do not take this lightly. Please like and share. Get this out. We want you to be safe during the holiday. Yes. And as always, co-host Thomas, how do we get a hold of you?
Producer, can you just roll it on the screen, please? You can reach me on Instagram at Limitless Outcomes, YouTube, Limitless Possibilities, LLC, and the website, limitlesspossibilitiesforyou.com.
Excellent. Thank you, Thomas. We appreciate you as always for joining us and being a wonderful co-host here. As always, we want to thank you for listening to Mental Health Matters with Marty. Again, my name is Martina Sellers, your mental health hygienist. Paula, we always are excited that you are with us. Cynthia, thank you so much. And again, we thank you. You can follow me on several of the social media resources. On Facebook, follow me on Mental Health Matters with Marty. On YouTube at Martinez Sellers. Again, my website at mentalhealthmarty.com. There you can find some amazing merchandise on there to help support you during your mental health needs and everything. So also, please listen and subscribe to my podcast. Apple listeners, please give us a 5-star rating and review. And become an iMatter member by texting iMatter to 31996. Again, iMatter to 31996. Again, thank you got tongue-tied there. Thank you for watching Mental Health Matters with Marty. Again, we don't want you to suffer in silence in the shadow of shame, but definitely we want you to speak up speak out, and live. Until next week.